Welcome to the Salzburg Global Seminar session on how do we learn about improving healthcare. My name is Rashad Massoud and I'm the chairman of the session. I'm really excited about this one. We've been in the area of improvement for now a few decades, and having inherited the science that came from industry and relied on the use of essentially time series charts to see if the changes that we're making actually work or not, and follow them in real time, and document the evidence of improvement using time series charts. We've over time been able not only to improve process level data, but also outcome level data. In recent years, we've been able to show reductions in complications in care. We've been able to show reductions in mortality. One example that comes to my mind, just less than a year ago, I was in India at the Ending Preventable Maternal and Child Deaths meeting, and I reported on our team's work in India. Working with the government in 6 priority states for USAID. Over an 18-month period, they had worked on 270,000 deliveries and were able to reduce perinatal mortality by 12.7%. That's the sort of power of the use of improvement methods that we're seeing, and that's just one example. There are many, many more. In view of such accomplishments, we're being asked a lot of questions, and some of the questions that we're getting are of the following nature. People look at these remarkable results and they say, how do you know that what you're getting is truly because of what you're doing? The changes that you're making are causing these results. Well, we do have our time series charts to sort of show that there's been a change, but we don't know that that change is necessarily due to what we've done, or that it's only because of what we've done and it's not because of something else that's going on. We don't know if what we're seeing isn't happening elsewhere independent of us, and so on. So the whole issue of attribution of the results that we're getting to the changes that we're making is becoming a question that we are at least receiving. So with that, we started to sort of look at some comparison sites. We started to do some stepped wedge designs. We started to calculate some differences in difference to see whether what part of the result that we're getting is truly due to what we're doing or not. But I realize we're only scratching the surface here, and there's a lot more to be done. Having been in conversations over many months now with colleagues and friends, we've really come to the conclusion that we need to delve into this issue. We need to answer some of the questions, and we know the answer is not simple. We know that we're not going to find one simple magic bullet, but we started to realize that there may be some framework that has multiple options on it, depending on what we want to learn, for whom, for what purpose, under what circumstances, that would allow us to have more rigor in the results that we are seeing, that would allow us to be able to better attribute the results that we're getting to the changes that we're making. And also another issue that's consistently coming up is, of all the things that we're doing, what is truly generalizable versus what is contextual? With that, I invite you all to join us in this amazing seminar that I'm looking forward to very much. We have some of the world's best experts in improvement, in research, in complex adaptive systems, in managing knowledge for healthcare. with us at this meeting, and I'm looking forward to it very much, and I hope that you will join us, whether in person at Salzburg or virtually through the web. Thank you.